Now, the next part is part comedy, part reality. And this is to give a little bit more respect to the people who ran around with aluminum hats, thinking that they needed to be protected from things. So over here in the blue, we have today's version of the people who think they need to be protected from everything around the planet. Well, the reality of the matter is that this is all to do with a fabric, a fiber, but it's really the story is electromagnetic fields. Now, we're accustomed to hearing about electromagnetic fields in the context of power lines, smartphones, microwave ovens, not that this restaurant has any, and whether or not these radiation devices have any harm on human health. And the reality is we don't really know. I mean, you can pick up everything from the World Health Organization. There's an outfit that has a thing called the Bio Initiative. There's the Lawson Clinic in Ontario. And if you browse around, you'll find that many universities are investigating the effects of electromagnetic fields. So before you all fall asleep, let me describe it this way. The newspaper headlines are always about low EMF, household currents, power lines, smart meters, cell phones, etc. But what has been ignored is the clinical use of EMF, notably in hospitals if you have a non-union of a bone that you fractured. So some orthopedic wards will trot out a nice little device, creates a pulsed low electromagnetic field, and we slowly see bone cells start to grow together. So if you go into Google, the internet, and you go into bibliographies, you'll find that EMF's been studied a long time. The issue, however, is that it's always the low frequency. About 30 years ago, a gentleman who's resident in Vancouver had a personal situation in the family, and it all originated around phantom limb pain. Amputees, arm or leg, above or below the knee, above or below the elbow, many of them rapidly experience acute pains. And usually it takes a lot of strong drugs, OxyContin and a whole bunch of other stuff, and it really doesn't eliminate them. So what they developed was what we can call today a smart fiber, a smart technology, which really has become what we'll call today a smart cloth. So a picture over here is a tracksuit, which was used in a study with Drs. Jack Taunton and Doug Clement at UBC in 1999. And the whole study was about the effect of the absence, and this is the key word. It's the absence of EMF, but the absence of high EMF. So for those people that think about that kind of stuff, the story isn't about is low EMF causing harm if you live in Tsawwassen. The issue is what happens when you have the absence of EMF to chronic pain, wound closure, and other conditions. The BC government, the Ministry of Health, actually funded research for the phantom limb pain in the late 80s. We have Drs. Clement and Taunton at UBC in '99. We have now a hospital in Greenville, North Carolina that did a study with amputees. And in short, we're finding that the absence of high EMF has a very dramatic effect on connective tissue. Connective tissue happens to be pretty much everything except my bones, nerves, hair, what is left, and my eyeballs. So that leaves a lot of organs and other tissues. So what we're investigating now is the range of conditions associated with connective tissue in our body that respond to the absence of EMF. We're not saying that EMF high is harmful. We're not taking a position on low, but the research that is being involved and conducted and published today is the clinical effect from the absence of high EMF. And you accomplish that anything from a wrist wrap if you got carpal tunnel. If you're an athlete, they were using tracksuits immediately after running. And then we have other applications that are used in hospitals like external bandages. And the hospital data is really the cool part because you can produce all kinds of studies that have got data, slides, graphs, and charts. But if you can actually demonstrate the wound closure of an amputee or someone who has podiatric surgery on their toes or any other, say, knees, for example, because the orthopedic surgeries are easy to monitor, you can track the rate of wound closure. You can track the evidence of scar tissue. You can track the secondary infections, and you can track the use of the patient's medication. And in all the studies so far, it's demonstrating over and over again that the absence of EMF has a profound effect on chronic pain, cellular function, and in the cases that we're continuing to see, cell recovery.